neurological condition in these data. So there's a lot more work before we can use these data for some of the conditions, and for many you can see the number is 0. So no validation for dystonia, Huntington, hydrocephalus, muscular dystrophies, etc. And so if we go to the next slide, it just gives you the ranges of how good are each of our administrative data at identifying the conditions listed on the left-hand column. These were the only conditions for which validation studies had been done to say, yes, we can use administrative data to follow these patients. So you can see, for example, for Alzheimer's disease and dementia, the sensitivity range, depending on the study, between 8 to 86%, very broad. And so important that in Canada, the Public Health Agency of Canada and the Canadian Chronic Disease Surveillance Neuro Working Group has been working with some of the members of the National Population Study to validate many of these conditions. So this is encouraging. And for many of them, we will be able to use these data for surveillance, such as epilepsy, multiple sclerosis, Parkinson's, and Alzheimer's disease and dementia. So the next objective was to summarize how are patients with these conditions identified, which are the main sources of data. So again, because of time, there's a lot of detail for each of these, but essentially many of the conditions, particularly for spinal cord injury and traumatic brain injury, administrative data are used. For some of for spina bifida, for hydrocephalus, as well as the brain tumor, often it is registries, either the congenital disease registries or cancer registries. But for some of the other conditions, multiple sources are used. And finally, our last objective was to develop an inventory of existing neurological registries in Canada. What we